Well, good morning, and my task is to try to take us through some of the numbers about the relationships between diet, health, and what are the implications for food systems around the world. So let me start by reminding everybody that when we talk about diet, it has two routes to change human health. One is the effects of what you eat directly on health and disease, and the other one is the route through obesity. And I'll be showing a little bit of both, but just a reminder that sometimes we underestimate the impact of diet if you only talk about the composition of diet. It also affects how large we are. So what I'm going to make use of is work not that I do, but that our institute is the coordinating center for a very large consortium of researchers. Our goal is to scientifically quantify health around the world, its determinants, to do this over time and to do this at the country level. For 188 countries, we cover the period since 1990 as much as we can, and we cover literally thousands of different health outcomes. Now, I just want to stress that what I'll show you is the work of a lot of people. There's a couple hundred of us in Seattle at the Institute, but there's more than 1,000 collaborators in over 106 countries who are an active part of trying to systematize what we know about the world around us. So, without further ado, I'm going to switch over to a series of live tools that are on the internet. So if you're interested in what I'm showing, you can find it yourself. Just go to healthdata.org. And so let's hope this works. We are going to start with, I'm going to shift to the world. We're going to look at death. And I'm going to show you the world of what people died from back in 1990. The blue boxes are chronic disease or non-communicable disease. Heart disease here, cancer, chronic respiratory, diabetes, digestive diseases. The red boxes are infectious diseases, and green are injuries. And as we've been hearing about, the world is changing. So from 1990 to 2010, big shift towards non-communicable disease deaths and a reduction because of successive programs in the infectious disease deaths around the world. And I'm starting also by showing the fraction of each of these diseases that's related to malnutrition, because I think it's a good starting point. We heard yesterday is let's remember there is malnutrition. And so you can see of diarrhea, pneumonia, and other infections, 20% is malnutrition. Nutritional deficiencies shown here, a large fraction as well. But if we want to switch now to looking at diet, first, the totality of diet. So it turns out that as far as we can systematize the world's published evidence on risk and the both published and unpublished evidence on what people eat around the world, we end up concluding that about 65% of heart disease is related to diet, a smaller fraction of diabetes, and about 14% of cancer. If we add the other arm of diet, which is high body mass index or obesity, what you'll see is that there's also quite a lot of diabetes, cancer, and heart disease that's related to diet. Now, I'm showing you death. We tend to think of preventing a death at age 5 is a lot more important than preventing a death at age 80. So if I switch to looking at years of life lost, how much of a lifespan people have lost, you see at the global level that infectious disease is still actually a big issue because it kills a lot of children and they're losing most of their lifespan. But nevertheless, diet in the globally, huge factor. And if we just stick a map down here on the bottom and we can have a look at the distribution around the world of diet, and let's look at a risk factor. Let's look at dietary risks. And you'll see on the bottom the fraction or the rate of diet around the world, and let's look at it as a percent by country. And you'll see that diet is a huge fraction of burden in all the high-income developed countries, 30 to 40%. And it's only in the poorest countries where they don't yet have transitioned into a lot of chronic disease that diet isn't a major factor. So another way to think about diet is to look at the giant transition in risk around the world. So I'm back in 1990, and I'm showing the fraction of disease outcome, years of healthy life, that's attributable to different factors. Top one there is childhood underweight, then diet composition, indoor air pollution, smoking, high blood pressure, et cetera. If we go from 1990 to 2010, suddenly you see that diet is now the #1 determinant of health around the world. This represents progress because we have reduced the burden of malnutrition, of suboptimal breastfeeding, of water and poor water, poor sanitation. And so in some sense, we are the victim of our own success, that now diet, high blood pressure, and smoking are the top 3 risk factors in the world. Now, diet is a broad category. And behind that analysis of diet are 15 different components of diet, each of which there is a systematic analysis of all the published studies to tell us what the risks are using all the world's published evidence, and then this attempt to figure out what people actually eat. And so the biggest contributor of the components of diet is low fruit consumption. Next is high sodium, low nuts and seeds intake, low whole grains, low vegetables, high processed meat, and on down the list. So there's a depth and detail behind the scenes of looking at diet that I then think can help us move on to looking at the implications for agriculture. So last but not least is to say, in another version of the world, that some of these risks related to diet are changing quickly in the wrong direction. And so I want to just profile obesity. This is the number of people in the world by age that are obese. This is a pyramid diagram showing age groups and the number. And I'm just going to play a little movie from 1980 to present. And basically what you find is that the number of people in the world are progressively growing, both because of population growth, but also, more importantly, rising rates globally of obesity. And so the transition of the world, which keeps going, we're almost to the end, there we go. So that's one of the #1 risk factor in the world, diet and obesity, if you put the two together, and it's getting worse. And that's not true for some of the other major risks, like tobacco, where fortunately we're actually making global progress. All right, so that's a little bit of our dynamic tools. Please use them when you go home if you're interested. Everything we produce is out there for people to use and freely available. Now, I've largely been talking about the relationship between diet and obesity and health outcomes. But of course, you can also think of other ways to quantify impact. And here's an analysis for the United States. We haven't done this for every country yet, but eventually we probably will. Simply saying that the effect of diet composition, if you got it right, if you had everybody shift to the minimum risk diet, you would save the US healthcare system $130 billion based on an analysis of the last 5 years of data. So there's huge health benefits, but there's also a potential to realize enormous savings in healthcare systems. Now, the epidemiology of diet, Professor Willett yesterday went through what we know for many components. The GBD is this attempt to systematize knowledge and also quantify in terms of actual outcomes. But you can reverse engineer this and say, if everybody took the recommended levels of each of the protective and the minimum levels of the harmful components of diet, what would that minimum risk diet look like? And I've divided, rather than into different food groups, to make this simple, into protective factors, the little amounts of harmful factors that we think, if you eat too much of them, cause you harm, but if you can eat a little bit, like red meat at a minimum level, and then those for which we don't really think there's any net harm or benefit, sort of neutral calories. And this is what you get as a composition of a diet based on the epidemiological data. But this is what the world actually has available. So on the left is the minimum risk diet, 2,000 calories in the various groups. And on the right is the world's caloric availability. So remember, this is just what's available for human consumption. There's also waste at home and waste in various steps along the way. But clearly, the harmful component of diet is much bigger than what it should be, and the protective component is much smaller than what it should be in an ideal world. The orange bar there are things that it would be prudent to avoid, but for which the evidence doesn't quite meet our bar for convincing proof for intake. Now, food availability is markedly different in different parts of the world. And when we've been thinking about sustainability and food systems in the last day, I think we've tended to have in mind the high-income world. But of course, if you look at the availability, there's sort of a paradox here, which is there is a larger fraction of calories consumed from protective foods, because some of them are quite expensive, like fruit and nuts, in the high-income world, smaller in the low-income world. But there's also a larger fraction of harmful things like red meat. So we have a little bit of both, and there's much more neutral calorie consumption in low-income countries. Also notice the size of the pies, that caloric availability in the high-income world is almost 3,800 calories, and in the developing world, or the low-income countries, we're still just above the minimum requirements, so 2,100 calories. And I think part of this relationship between rising income and food availability is also one of the more central tasks or challenges ahead. Now, we did a little experiment here, or an analysis, which said, if everybody ate the minimum risk diet, what food groups are not sufficient at the global level? This is not taking into account the fact that low-income countries don't have access to more expensive products, just globally. And what you can see is that global fruit consumption needs to increase quite substantially. Milk consumption, because actually there turns out to be, on the systematic review side, cardioprotective effects of milk consumption. Nuts and seeds, particularly low. And then an enormous overproduction compared to what's optimal of red meat, and a somewhat underproduction of vegetables. So as we think about can everybody eat a minimum risk diet, there's even at the sort of gross macro level a number of mismatches. So how big a challenge is it to get the world to shift to a minimum risk diet? There's a whole series of issues around consumer preferences and education, and how do you encourage a minimum risk diet. But there's also the sort of swimming upstream phenomenon, that as people get richer, caloric availability and caloric consumption goes up, and the computation of these numbers for 7 billion people is really if you could get people to have that 2,000 calorie minimum risk diet. The part also that really leaps out if you drill deeper into the data is that some of the components where people grow the food, like fruit exporting nations, tend to have some of the lowest consumption of those goods because they make much more money sending them abroad for high-income countries to consume. So there are challenges also, particularly strong, I believe, in shifting to a minimum risk diet in countries in transition as we look forward. One of the things that I think we've all sort of hoped in the conversation in the last day or two would be the case is that if we followed a minimum risk diet, that's automatically good for the planet. And it's roughly true, because the minimum risk diet does move you away from some things that have quite substantial consequences. But it's not always true. And I'll give you the example of where we try, and this is where I think there's a lot of need for further work and further evidence, but where we try to trace what is the greenhouse gas, energy intake, antibiotic use consequences as examples of the different types of food groups, we will find that some things that are more or less environmentally sustainable. Good example is the dairy issue, where evidence suggests that milk consumption is good for you, but we would have to double dairy production globally if everybody were to consume that minimum risk diet, and that would clearly have consequences on sustainability. So we will eventually, as the science gets stronger around diet and our understanding of the consequences gets stronger, we are going to have to see some trade-offs between what is minimum risk for the individual and what is necessarily ideal for the planet as a whole. And I think that's a set of trade-offs that we haven't talked about because there's been the hope that the two are perfectly aligned. And I think in general there's a strong correlation between minimum risk and what's good for the planet, but there are trade-offs to be made. The last thought that I'd like to leave us with is the desirability of producing, in addition to a metrics framework for thinking about diet, health, and sustainability and agriculture, is can we produce a single summary about how sustainable and the zone of overlap of these three areas. What's the use for a summary? Well, summaries are a very powerful way to communicate to audiences that don't want to drill into all the detail. People get lost in the detail. And so it's often very useful to have a rolled-up summary and then to have available all the details. You can use it for assessing global progress. Are we actually moving in the right direction, or are things getting worse? You can set targets. You can monitor the progress of particular nations. And you can use summaries to disentangle the importance of different components. But what would we actually measure if we wanted a single measure around this three areas? And I think something along the lines of what's the prospects for human populations now and in the future of living healthy and fulfilling lives, with a particular focus on quantifying what the risks are as you go forward from lack of sustainability, lack of sustainable food systems. Now, that type of forward-looking metric requires us to predict the future, and that's always a risky business. But it does actually reflect the set of concerns that we have all been talking about around the room. And so it's an imperfect measure of this area is probably better than no measure at all that helps us see the quantification going forward. So I believe on the metrics front, we have a lot of knowledge, imperfect, but can be improved, about the strength of the link between diet, working through composition and through obesity on health. We have some understanding of how different food production around the world and what is its contribution to, or lack of contribution to, sustainability. And the agenda here is to bring all these three areas together in some coherent way. So thank you very much.